All right, I want to welcome everyone back to the 5th Annual Hemispheric Security Conference at Florida International University. My name is Brian Fonseca. I serve as the director of FIU's Jack D. Gordon Institute for Public Policy. And it's certainly an honor and privilege to have all of you with us today. Apologize for the delays as we worked out some of the technical issues, but we are fully online and ready to go. Just to recap, this week we've touched on a broad range of security considerations facing the hemisphere, from the threats posed by transnational criminal organizations and rogue governments to the impacts of migration and on the socioeconomic infrastructure throughout the region, and of course, the implications of weak and fragile democratic institutions. We've also touched on the role of military institutions and the role of gender in provisions of security and peace. Today, we're going to dig a little deeper into the impacts of global pandemics on the citizen and national security landscape. To lead us in that discussion, we have with us Dr. Aileen Marty, a world-renowned infectious disease doctor that has spent more than 40 years conducting clinical and research work in the fields of infectious disease, public health, outbreak response, and mass gatherings. She was born in Havana, Cuba, and Dr. Marty's family migrated to New Jersey and settled into Miami. And in 1982, she received her medical degree from the University of Miami and was commissioned in the US Navy, where she spent 25 years as a naval officer, I believe reaching the rank of commander, during which time she served as the chief of infectious disease at the Armed Forces Institute of Pathology. Professor Marty has held billets with the United Nations Monitoring, Verification, and Inspection Commission and the World Health Organization. In 2014, she was vital in the US response to the Ebola crisis in West Africa. I could go on and on about Dr. Aileen Marty's years of service. Currently, she's professor of infectious diseases at the FIU Herbert Wertheim College of Medicine and leads FIU's tropical medicine program. And so without further ado, I cede the floor to you, Dr. Marty.
Thank you so much. It's a pleasure to be here with all of you and an honor to be here with our panelists today. We have 4 remarkable world-renowned scientists here who are going to be looking at the challenges that Latin America is facing because of COVID and how that intersects with their security considerations and problems that already exist in the environment. Our speakers today include Dr. Marcos Espinal, who is the head of communicable diseases at the Pan American Health Organization, which is the Western Hemisphere part of the World Health Organization, although it existed before WHO did and has a long and illustrious history. And so he will be speaking to us about aspects of the IHR and many other key points. We also have our own Dr. Carlos Espinal, a dear friend of mine, who has been working throughout the Latin America for many, many decades and is well known to the area as an amazing scientist who has particular expertise in drug and vaccine development. And I know he'll bring that to our attention. The next speaker will be Dr. Phil Williams. He's a professor at the University of Pittsburgh who has very illuminating insights and experience with organized crime and terrorists and so forth, and how those problems are manifesting in Latin America. And he's going to show how those intersect with the health issues that are going on there now, including, of course, the situation with COVID-19. And last but certainly not least is the wonderful Dr. Carolina Sampo, who belongs to CONICET, which is an Argentinian organization that has enormous knowledge. She has enormous knowledge on aspects of healthcare in Latin America and how they intersect with the security interface. So without any further ado, Dr. Marcos Espinal, please take the lead.
Thank you very much, Dr. Marty. Good morning, everyone. Thank you to the Florida International University for the invitation. It is a pleasure being with you today. Incidentally, Dr. Marty referred as PAHO before WHO, and we are in a security conference. PAHO was founded in 1902 by the United States because when the construction of the Panama Canal, because of the threat of malaria and dengue. So security, power is related very much to security. Now, let me go to my 5-6 minutes introductory comments. COVID still progressing in the world. Today, we just passed 5 million people affected by the disease, more than 225,000 deaths, and we are counting. Countries more affected: the United States, Russia, and Brazil has taken the 3rd place. In Latin America, Brazil, Peru, Chile are the countries leading the way in terms of number of cases. And several of these countries are going through a massive epidemic today, switching from Asia to Europe and then Europe to Latin America and the Caribbean and the whole of the Americas, basically. So we have not yet seen most of the COVID in Latin America, in South America, and the Caribbean. How can we address COVID? I think the backbone of the response, preparedness and response for COVID is the international health regulations. What are the international health regulations? People think the IHR is only dated back to 2005 when the 196 countries adopted this binding treaty, because it's a binding treaty. When a country signed up, it commits to implement the core capacities of the IHR. But the IHR dated back to 1851, to the Sanitary Conference in Paris, the International Sanitary Conference, when they adopted the International Sanitary Regulations at that time. In 1948, WHO adopted the International Sanitary Regulations that were renamed in 1969 as International Health Regulations. What happened in 2005, the International Health Regulations were revised to expand the scope, to prevent, detect, protect life, and prevent diseases of infectious nature. We live in a globalized world, huge trade. So this is a don't respect border. So the response the countries need to implement are really based on the core capacities of the IHR. What are the core capacities? And this has to deal a lot with security. Well, the core capacities are what we can call public health functions. These are essential public health functions. And to mention some of them: preparedness, surveillance, laboratories. What you've been hearing those days, all of you, regarding COVID, how do we test, how we do surveillance, coordination, policy legislation, provision of equipment to protect people, like PPEs, personal protective equipment. So these are some of the public health functions that needs to be strengthened in countries, that they have been doing it for some time, and now WHO and partners in many of the countries are doing evaluations for the last few years to assess the level of the implementation of the core capacities. And of course, it always it's work in progress always, because the IHR is not an ending treaty. It needs to continue because, you know, we had H1N1 in 2009, we had Zika in 2015, now we have COVID, and we have more. So important that the IHR are strengthened. And you know, we talk about COVID today, but let's not forget that Latin America and the Caribbean and other parts of the world has also other problems. And in terms of infectious disease, deal with security, the dengue epidemic, for instance. 3 million cases of dengue were reported in the Americas last year. So we had Zika recently. So it is important that we don't only think about COVID, but we think dual epidemics. In Latin America today, dengue it's been a major issue running along with COVID. So, and that's the beauty of the international health regulation. All these capacities, essential public health functions, are useful, or they are the backbone to address many of these epidemics and emerging infectious diseases that we are dealing with today. The response will continue. The Pan-American, I conclude with this, the Pan-American Health Organization is working with the countries of the Americas 24/7. We have recommended a package of 9 pillars. Some of them I mentioned, like surveillance, laboratories, risk communication, personal protective equipment, and education to the population. Because remember one thing, in our region, the Americas is the highest inequality region in the entire world. Of the 6 regions of the World Health Organization, this is the most inequitable region. It's a region that grows economically, but wealth is not well distributed. So we still have the barrios, the favelas, people living in extreme poverty, people living in very small rooms where it's difficult to implement social distance and all these type of things. So I leave it there, but the key message is we're not yet finished with COVID, and we need to continue working with countries to ensure that they strengthen prevention, non-pharmaceutical measures, and when the medicines come and when the vaccines comes, they are swiftly introduced into our countries, not only in the Americas, but worldwide. Thank you very much. I'll pause here, Dr. Marty, and I'll be ready for Q&A whenever you decide. Thank you.
Thank you so much, Dr. Marcos Espinal. That was superb. And I have all kinds of questions, but we need to move along right now to Dr. Carlos Espinal, who again is the director for FIU Global Health. And please let us know your thoughts on the challenges of COVID-19 within the health security environment for Latin America. Carlos?
Well, just good morning, everyone, and very happy to be here with all of you and the participants and attendees. As just want to reinforce the key messages of Marcos Espinal, in the sense that COVID-19 just came to the region to make more visible the critical situation on inequity, social, economic, and health inequities, in addition to the violence. I mean, Latin America, and especially Central America, is perhaps the numero uno violent region in the world, especially affecting women and children. So COVID-19 just came to make this critical situation more visible to us. And it will really increase this poverty and limited access to the economic development and human rights and so on. So it's a very critical situation for us. In terms of testing, for instance, we know that testing is our central metric for understanding how the virus is spreading in the community. So if we have countries with few testings, then we have countries with few cases. That's as simple as that. And I want just to share with you this data that we have as May, let me see this. As May 12th, and you see that out of 655 million people, as May 12th, we have only tested in Central America, South America, and the Caribbean, 2.4 million people. This is about 482,000 per million of population. So this is really, really low in terms of testing in the region. We have a great challenge because of the cost of the PCR test, that is the most used test at present time. And we also have very high limitations in terms of laboratory capacity in most of the countries, except Brazil, Mexico, and Colombia, and Argentina, where we have also decentralized the testing using different resources, universities, and so on. So, but today, testing is critical not only to establish the trends of the infection and the mortality and so on, but also to be able to evaluate with the adequate test the strategies that we use in the region. So this has been very critical. Most of the countries are using now PCR, but we are slowly moving, for instance, like Peru, to antibody testing. But antibody testing is not the ideal testing for mass identification of positive cases. And we still remains to be seen the useful of the antigen detection test, which has not been implemented in almost any country in the region. So the situation is very critical in this sense, and again, few testing, few cases, and difficult to establish the real or the true burden of disease of COVID-19. We don't do more and expand the testing capacity in the region.
Thank you so much, Dr. Espinal. That was very, very enlightening. Okay, so our next speaker is Dr. Phil Williams. And Dr. Phil Williams, I very much look forward to your take on the security aspects of this problem.
Thank you, Dr. Marty. It's a pleasure to be on this incredible panel. And thanks to Brian for the invitation. I'll try to be very quick in my comments. But I want to think more generally than organized crime, to think about globalization and states before and after the pandemic. So here are my key questions. Here are the key questions. What impacts will the pandemic have on globalization? What are the impacts on the states of Latin America? And then what are the impacts on criminal organizations and mafias? And trafficking organizations and mafias are very different in certain ways. I draw a lot on some of the work's been done by the Global Initiative and Inside Crime and OCCRP, who follow these issues on a daily basis and provide great insights. So I think globalization has become well established. It's all about flows across borders. And in 2009, I did a piece where I said that in the event of a pandemic, borders would have the stopping power of tissue paper. And that's about right. We've also seen, I think, globalization interrupted. But globalization has been well established. It involves reduction in transaction costs, partly because of containers and partly because of high tech. We've had winners and losers, but the US in recent years has seen itself as one of the losers. We've had failed attempts to establish really effective global governance. And as a result, we've seen a backlash. And I think COVID-19 might well play into an intensification of this backlash. So what we have, I think, we've seen this interruption of globalization, vulnerable supply chains, too much reliance on just-in-time inventories. Where we're likely to go after the pandemic, it's not clear. We could see globalization plus. We could see globalization hedged with some key dimensions still operating, but self-sufficiency in certain key sectors. We could see it reduced, or we could finally see it destroyed. And I think on that last point, a lot will depend on the outcome of the election in the US. In terms of Latin America, let me start thinking globally. Globally, I would argue only 25% of the states in the world are strong and effective. There are an awful lot of weak states. These are some of their characteristics: low legitimacy, low capacity, absence of consensus, too exclusive, inequality. And the Latin American state, I think, is indicative of all these problems. These are some of the descriptions: truncated, captured, leviathans. One of my favorites is Jorge Shabat's notion of criminally possessed states, particularly in Central America and Mexico. I think when we're looking at the state, we also have to think about the very debilitating impact of neoliberalism. Neoliberalism is hardly ever talked about in the security debate, but you look at the work of sociologists and anthropologists, and it's a huge factor. It's a huge discussion. So here's the notion of neoliberalism. It's basically all about the market, state getting out of the way. And I think in many ways, this has been used by some of the Latin American elites, and they've consolidated their position through the state apparatus. But we have the neoliberal state, which really allows for removal of social safety nets where they long existed. And it goes back to the points that have already been made about inequality. In terms of the impact of the pandemic, few Latin American states, or few states anywhere, actually have covered themselves with glory. Here's why a lot have failed dismally, I think. We've seen indifference to public health expertise. I think we've seen that to a degree in the United States, we've seen it in Brazil, and we've seen it in Russia, as already mentioned. It will have a corrosive effect on legitimacy in Latin America, and I think will intensify an already existing crisis of governance. And my sub-bullets at the bottom there about the things that I think will happen. We will have a new debate, a more intense debate, about the responsibility of the state to its citizens. We could see the state and neoliberalism challenged as the dominant ideology, and I think it will give a boost to alternative forms of governance, which leads into organized crime. And I think here you have three phases for the impact on organized crime: the short term, medium term, and long term. In the short term, we've had dislocation of drug trafficking, but we've already seen adaptation and exploitation. We've seen some gangs ease extortion demands while others have maintained them. But we've also seen a remarkable increase in paternalistic behavior and a decrease in predatory behavior. This builds social capital for organized crime. It's not confined to Latin America. We've seen this in the past with the Yakuza in Japan, which helped in the 1995 Kobe earthquake and actually helped in the cleanup of Fukushima. So organized crime can at times be very paternalistic. And I think you're seeing this in the short term. The medium term, we'll see diversification of the portfolio, consolidated, alternative governance expanded, organized crime increasingly infiltrate the legal sectors by lending money for firms in trouble and then taking those over. We'll see the line between organized and cybercrime becoming blurred. And we will see, I think, generational succession. If organized crime disproportionately, if COVID-19 disproportionately harms the elderly population, then this will contribute and feed into a generational succession in organized crime. For the long term, I think we'll see drug trafficking as only one of many aspects of Latin American organized crime. We'll see a growing consolidation between organized crime and cybercrime. And we'll see money laundering become much easier because of the number of ostensibly legitimate firms that have now been taken over to organized crime. So those are just some of the issues. And I know Carolina will pick up on some of these themes. So thank you again for listening.
Thank you. That was incredibly fascinating, and I appreciate that. Now we're going to move into Carolina. Carolina is going to talk about the reactions of societal and how society considers staying at home and how that's impacting on the entire security interface of Latin America. Carolina, thank you.
Thank you so much, Dr. Marty. Also, I want to thank Brian and Florida International University for the invitation. I would like to share some ideas with you. Let me please try to share the screen. Very quickly, as Dr. Williams has just done. I don't know how he did it so quickly, but I just want to point out some things. The first thing is that responses to government actions from the society in Latin America has shown like 3 different stages. The first one is the high compliance they have shown linked to the experience that were watching at TV and all media in Italy and in Spain. During this first stage, it was very easy to contain the movement of the COVID-19. But the problem is that this stage came to an end due to especially economic issues that were contemplated at the first time for the government. For example, if we take El Salvador, where the government give families almost $300, if I'm not wrong, to survive during these lockdowns, but and also Argentina and also other countries in the region. But the problem is that states, as Dr. Williams has shown, are weak and they don't have so many resources. So it is very difficult for them to keep on giving economic aid to different people in different stages of society. So due to economic reasons, and also because we were waiting for this wave that was happening in Italy and Spain, and it didn't happen, at least up to now, except from Brazil, that we have been seeing, and also maybe Peru in the following days. But due to that, people start breaking the rules and start going out in this scenario. And this second stage in the reaction society has developed after government measures, we can see also the rise of protests against quarantines. But these protests are not only focused on the freedom, which is one of the reasons. For example, in Brazil, we have protests also led by the president, but also because of economic reasons. We have to bear in mind that most of the people in Latin America, 1 every 2, is living from informal economies. So it's very difficult for them to stay at home in this scenario. We have seen protests in Chile, we have seen protests in Colombia, and we are seeing protests in Brazil. Not only because of COVID, but also because COVID has shown a lot of political tensions between the president, the circle of the president, the circle around the president, and also the opposition, which is not homogeneous and very well built, but it's important to bear in mind that the idea of getting out Bolsonaro is growing and it's getting stronger every day. The problem is that in Latin America, we have, as I said before, very high level of informal economy. So if people don't go out and work, they don't actually eat. And states have planned in short term, but they don't have planned that the pandemic could last, we don't know how much time, maybe 6 months, maybe 2 years, we don't know. So in this case, we have a very strong demand from social society, but we don't have the response from the state. At least we are not seeing a response in the long run. So in this sense, we need to think that this may lead to a biggest opportunity to organize crime, as Dr. Williams has pointed out. In the first time, organized crime has shown some difficulties. So since they had to slow down, at least not to cut, but they have to slow down their activities, they have turned into the locals. They have turned their efforts into communities. They are strengthening their hardcores through for example, develop of different programs, as you have seen, as you can see in these pictures of delivery with help, with food, with soap, with services that are essential are not being provided by the state, not at least in every single place, as Dr. Espinal has pointed out if we think in the favelas, in the slums, in the barriadas, we have a lot of places where the state has a lot of difficulties to get in. Places where organized crime has territorial control and in some cases also has criminal governance. So this especially this scenario is an opportunity for organized crime to get new people into their organizations, and the state needs to be one step ahead in order to avoid that. In this sense, I think that is very important, or maybe very important, the role of women leaders in communities, since these women are actually organizing people in order to make the lockdowns actually enforced inside these emergency places, inside the slum, for example. The state could work with them in order to be one step ahead of organized crime. But we need to think that even if organized crime is being hit by this pandemic, they are not going to be defeated. And if we, as part of society and the states, work together in order to avoid them, winning new strength, building more power, this can get worse in security terms. So I leave it here so we can talk about whatever you want in the questions and answers.
Thank you so much, Dr. Sampo. That was fascinating. I would like to go back first to Dr. Marcos and ask him regarding the IHR and some of the questions that he's posed. Do you see special challenges to the IHR as it evolves under this particular situation with COVID, and how that intersects with what we've been talking about?
The answer is yes, because more and more we are seeing emerging infectious diseases. So the key issue for countries is to continue strengthening the core capacities of the IHR, being also creative and innovative about new ideas on testing, on isolation, on more modern protective equipment, because this is not going to stop. I mean, COVID might go down, and then we don't know yet if it's going to become a seasonal disease like the flu. But other emerging infectious diseases are there, and some of them even unknown. As an example, arboviral diseases. We talk about dengue, Zika, and chikungunya, but there are plenty of arbovirus that has not been yet characterized. So for us, the key issue is governments and countries putting and investing more in health. And part of that investment is to strengthen IHR. Many of the countries in our region do not invest at least what PAHO recommends, at least 6% of the public, 6% of the GDP should be assigned as public investment in their countries. And many of them are investing only 3, 4, 5%. So, and this is the minimum that PAHO is recommending. So let us not forget also that Latin America and the Caribbean has a dual profile of non-communicable diseases and also communicable diseases. So the key issue is that it's not going to be easy. So the message is keep strengthening the IHR core capacities. Over.
So, can you hear me now?
Yeah.
Thank you, Dr. Marcos Espinal. That's very important. And based on what he said, I want to ask Dr. Carlos Espinal. Dr. Marcos Espinal talked about all these other viruses and all these other infections, some of which we know may have overlapping symptoms to those of COVID. What challenges do these background endemic diseases have in trying to rein in the situation of the COVID-19 pandemic? And with the development of even vaccines, will there be any chance of possible issues regarding that, or drugs and what have you? Your thoughts?
Well, we are going through a critical situation also with dengue, and now in many countries in the South Cone and in Central America and in tropical region of South America, we are entering into the flu season. So flu season plus COVID-19 could be a really serious complication for patients, and mostly for the surveillance system, how to differentiate early a COVID patient from influenza patient. That's going to be a challenge. So this is why we need to adjust the case definition now that we have a community transmission in most of our countries, and not continue with the dependence of the related travel cases anymore. We need to develop certain similar case definition as the COVID-like disease, like the flu-like disease, in order to be able to monitor and differentiate both viruses. Dengue is also a very critical point today. So we really need to strengthen the disease surveillance system and to adjust the case definitions to be able to monitor and to evaluate the potential complications of simultaneous infections, dual infections in patients with COVID and influenza, for instance. We don't know how the situation is going to be. In terms of vaccines, well, we know that there are at least 20 vaccine candidates today. We hope to see good and solid results in the near future for this COVID-19 pandemic and epidemic. We don't need the perfect vaccine. We need a vaccine that will be sufficient to produce a solid protection, or at least a long-lasting protection, at least a year, like the flu vaccine, for instance, or even more, hopefully, in order to reduce the potential burden in the most at-risk people and in the rest of the population. The vaccination programs are really critical, in a critical condition today. We have seen already some reduction in vaccination coverage in some of the critical vaccines, especially in the school-based programs, like where we use this strategy to improve the vaccination against HPV and pertussis and tetanus and diphtheria. Also, we have seen a reduction on the vaccination of the elderly population with influenza right now and with pneumococcal disease. So there is also a very good opportunity under these conditions to be really innovative in how to access the population. The population is very much afraid to go to visit any clinic, any pediatric service, any vaccination service, and it's something that we need to really pay attention right now in order to avoid potential outbreaks like we are having now in Mexico, 175 cases of measles. In Argentina, in Colombia, some few cases. We don't want to see outbreaks in addition of vaccine preventable diseases, in addition to the COVID-19, in addition to dengue and the yellow fever and other important vaccinations. So the situation is, again, critical, and we need innovation and creativity to approach the population and to give the key messages and how to prevent and how to improve the vaccination programs in the region.
Thank you so much, Doctors Espinal.
Carlos and Marcos will be much easier. We are very good friends, not related, but very good friends.
That's wonderful. Well, you may be related in some unknown way.
Well, who knows, yeah.
Yeah, so Dr. Williams, you gave a very, very rapidly, gave us a tremendous overview about all levels of vulnerabilities that involve all kinds of non-state actors, let's say, some of which are criminal elements. And you talked, among other things, about their supply chain, having difficulties with their supply chain regarding substances coming from other countries such as China that they rely on. How much of a factor is that in what's going on with organized crime, these supply chain issues they may be facing? And can that be to our benefit, to the proper government?
Thank you. I think long term it can, because I think but one of the things we've seen is the changing nature of the drug business. So increasingly we will see, I think, particularly opiates coming directly from China into the United States. And in some ways, I think that we're going to see the gradual diminishing of drugs based on botanicals. And increasingly it will be all about synthetics, which mean that the drug supply lines, the drugs themselves, the supply lines will become much shorter, except for the China, but even that with things like fentanyl pills, they're so easy, they come in FedEx. We've seen them move already from the container to FedEx boxes, if you like. And I think that is an important thing long term. That gives some opportunity, but it also suggests that Latin American drug trafficking organizations will need to broaden their portfolios. And I think we're already seeing that with their involvement, for example, in illegal logging, their involvement in illegal gold mining, their involvement, particularly in Mexico, but also elsewhere, in stealing and siphoning oil and gasoline. So I think you're starting to see this broader portfolio develop. And I think that's one of the key changes. In some other countries, it's gone the opposite way. So the 'Ndrangheta started in southern Italy, in Calabria, started as a local organization involved in extortion and kidnapping. Now it's become a major drug trafficking organization linked to Latin America. So they've expanded and broadened their portfolio. I think we're going to see something very similar now. And COVID won't be the cause of that, but it will be an extra impetus for that, broadening your portfolio and becoming more resilient, as I think we're going to need to do with licit businesses and licit supply chains.
Thank you very much. Let me just go over to Dr. Sampo. Dr. Sampo, you have a fascinating view on this as well. And one of the things you addressed was the role of women in helping to counter the effect of the organized crime in organizations. I would like to ask you if there is a risk to women who then put themselves in this position of helping.
Yeah, thank you for the question. Well, there is a risk for everybody who runs into business with organized crime, right? So, of course, there is. But what I try to say that it is that women can be used between being carefully with the use of word used by government as well as by organized crime. Bearing in mind that organized crime will try to use them in this scenario, is that I think that governments can try to read them before. So in that case, we can count of them as agents of change. So they will be able to help not only other women that are, as one of the doctors said, very vulnerable in terms of violence, for example, but they will be able also to help the young. As we know, organized crime is especially related to male and especially related to the people between 15 and 25 years old. So it is very important thinking in the becoming generations, the role of these women in order to avoid the growing of organized crime structures.
Thank you very much. And now I'm going to take some of the questions that are on our Q&A sheet. Here is, they seem to come and go. Here's one from Christopher Meyer. He says, in light of the upcoming hurricane season, how does the panel see COVID impacting the ability of governments, intergovernmental organizations, which of course this is very important for the Caribbean, and non-governmental organizations in being able to support disaster response and recovery efforts?
If I may jump in, Dr. Marty, this is Marcus. A very critical question, because as we all know, the Caribbean mainly, it's subject to a lot of natural disasters, not only hurricanes, but the other types. So, and it is important that this is taken into account. There's no way, because we always have 7, 8 hurricanes in the season. So the key issue is many of the actions on epidemics, of course, always considering the difference between one and the other, can also be applied and in natural disasters. And the Caribbean mainly, in Latin America, has a lot of experience on this. PAHO has a program of more than 35 years on helping countries to cope with natural disasters. But let us not forget, it's not only about COVID. Hurricanes bring accumulation of waste, accumulation of water, and then the infamous Aedes aegypti, start breathing again, and then we have dengue, and we have other viral diseases. So it's a recipe for a major combination disaster. So preparation is important, and that is also related to the issue of keeping preparedness, readiness, and response always on top of our leaders in government. One thing important to remember is education, health, and investment in these areas are not the most attractive in many countries. So we need to keep pushing. So countries are more and more prepared. We just saw what happened in the Bahamas recently, the devastation. And if we combine this with COVID, with dengue, so massive human tragedy. So preparation, readiness, response, health security, critical areas that we need to keep strengthening, and education to the population, because sometimes the people, we need to keep educating continuously. It's not only, because this is not a 100-meter race, it's a marathon, basically. Thank you. Over.
Aileen, one comment related to this topic, if I may. 2 days ago, I was in a very important discussion in one of the TV news in Miami, in terms of how are we going to prepare the community and the shelters for the hurricane season. I mean, what the specific question is that if we already have guidelines for shelters in case of hurricanes and how to protect the community and the people. This is a very critical point. I already talked to our Dean, Aileen, that we could really have a really interesting approach to this, to develop those guidelines. But PAHO needs also, as a suggestion to Marcos, to work in the guidelines for the Caribbean. South America is not affected by hurricanes, but it is the Caribbean and the United States, especially Florida, that is really in the front line of the hurricane, and it's just in 2 weeks. So we really need the guidelines for shelters. And how are we going to do it? I mean, are we going to put everybody together, COVID positives with high-risk patients or high-risk groups? Are we going to develop shelters just for non-infected people, naive people? Are we going to have in the shelters washing elements and protective elements for the people and for the doctors working on the shelters? I mean, the whole topic is really a hot topic, and we need to stress the guidelines, but now, because hurricane season is starting in 2 weeks.
Absolutely right. Thank you so very much. I remember when some of your comments reminded me when I worked for the Department of Homeland Security, we were so worried about a terrorist bringing in soybean rust, and then hurricane and brought soybean rust to the United States. So we didn't, the terrorist was the hurricane. The hurricane, Mother Nature is the greatest terrorist there is, and we have to confront these dual challenges all at the same time. There's so many wonderful questions here. Here's another one for specifically targeted by James Zapata for Dr. Marcos Espinal. He said, to define pandemic strategies, the statistical information of the countries is very necessary. He wants to know something I want to know as well, is how reliable do you think are the data that are being provided by the countries of Latin America? Can you point out some countries that are more reliable and some that need work?
Yeah, that's a very good question, and I agree with the question that you need strong data and reliability, but it's also problematic to generalize because countries are different. In the Americas, we have high income, middle income, and low income countries, and the Americas, in general, it's a middle income region with fewer sections, as we know. Countries like Chile, for instance, has an outstanding testing program, and they are testing more than 15,000 people per 1 million people. Panama is doing a great testing, more 10,000 tests for 1 million people in a country of 4 million people. But there are others, and you probably saw that in one of the press events of PAHO, the director of PAHO referred openly to Nicaragua as the need to step up in terms of collaborating with PAHO and working with PAHO to ensure the data becomes more reliable. So all the countries are reporting with all the pros and cons and the weaknesses that they have. But definitely I go back to my statement at the beginning, this is an ongoing work of strengthening capacity, and surveillance is one of the capacities of the international health regulation. So our message to the countries is keep strengthening, keep pushing. We're not satisfied with, if you are testing, like for instance, we have seen countries in Central America testing less than 1,000 people per 1 million. We tell them, this is not good. You need to test more. You need to test more. At the end of the day, countries are sovereign and they make the decision, but us as a public health agency, we tell them, you need to test more. Otherwise, the country will be fooling itself by not knowing what the clear picture of the problem is. Thank you.
Marcos Espinal, Dr. Carlos Espinal brought up the issue, a lot of issues around testing. And one of the issues with testing that even here we're facing in Florida is a supply chain issue and the cost of kits, because depending on what platform you're using, in other words, what company's PCR machine, you're pretty much restricted to those particular kits. And WHO has spoken repeatedly about being able to provide aid to countries. And since we're on the one hand asking certain nations to do more testing, how do you see WHO perhaps facilitating this supply chain issue so that they can accomplish what needs to be accomplished as you have just described? Either Dr. Espinal can answer this.
Marcos.
Thank you. That's a very key question. And let me just qualify also that, because not all rapid testing is good. Remember, there are plenty of new tests that are rapid testing, detecting antibodies that are not really up to the standard. So we need to be careful. And the recommendation from PAHO and WHO is diagnosis should be based on PCR testing, basically. That's it. Now, given that, PAHO has a very important mechanism. It's called a strategic fund for supplies, where the countries of the Americas, and it's the only one in the whole of the 6 regions of WHO worldwide, countries of the America put their money in there, and PAHO does pool procurement of and suppliers that has been pre-qualified by WHO. And with that, and we are able even to help countries that they don't have the money, because we can use the money and they can pay later. So PAHO is already facilitating that. We acknowledge the fact of shortages of testing, and that is the reason the director a few weeks ago called for a major development, and the countries of the G7 and other high-income countries, rich countries, to make sure tests are also available to less developed countries or lower income countries, because this is not a responsibility only of one government or one country. It's a global responsibility. So I think these type of mechanisms, we also have the strategic fund, the revolving fund for vaccines, which is another great mechanism to deploy the vaccine when they is ready. Remember, the Americas is also the region that probably vaccinate more than any other region, was the first one to eliminate polio and so on. So there are mechanisms available. And the key issue is that countries sometimes, which is a challenge, go ahead and buy directly. And in some cases, some people go and offer to governments, oh, this is the greatest test, without making sure we double check that. It is important to work with international accredited public health organizations, because otherwise, you know, our countries, some of them still have a long way to go in terms of making sure they get the best. So the message is, work with us. We're not perfect. We also make mistakes. Who doesn't make mistakes? But in these times of pandemics, you have seen the fake news issue, but it's not only fake news. Test is a tricky issue, and many of the tests are not really good. And we have countries in Latin America using tests that are not really good. Thank you.
Important. Thank you so very much for your comments about the different types of tests that are available. One of the big challenges for us is before we buy a machine from Abbott or Roche or whatever to do RT-PCR or to do antigen or to do what have you, is getting that reliable information about specificity and sensitivity and relative values of these tests. And I think WHO should actually name names and show what the statistics are for these, because that would be a huge value for many, many countries worldwide and for laboratories in every country, so that we can more effectively choose the best platforms. And right now, I've looked at the FDA sites and it's not available. Meanwhile, there's a question here for Carolina from Ariel Gonzalez. He wants to know how the COVID-19 would affect the transnational criminal trends in what's called the Southern Cone. Carolina? Dr. Sampo, I think we've lost her. So here's another question. There's a few questions here about treatment instead of vaccine. Some questions specifically about hydroxychloroquine and its relative value. I'm going to see if one of you would like to take one of these questions about treatments that are currently available, various treatments from Disavir and so forth that are being tested, and your thoughts on the currently available research for these various treatments.
Well, just a brief comment. Because the question is very much related to hydroxychloroquine and its combination. Today, there has not been any proof of efficacy, really, truly efficacy on the hydroxychloroquine, not even as a prophylaxis or as a treatment. Even more, there has been some very serious side effects in the clinical trials, and some of them has to be discontinued precisely for this reason. There are some antiviral that has been approved with a relative low efficacy of 35%, and is the only thing available today. There are also antibodies and monoclonals that has been, and plasma that is under evaluation, but the situation is so desperate that everybody's taking, as the news appears, as the last truth on chemotherapy. And today, the information is very scarce and very weak in terms of effectivity. There is the vaccines and treatment are a complementary strategy. We cannot just say that one will be more needed than the other one. It has a different scenarios. One is for prevention and the other one is for treatment, and both of them are complementary. Aileen, you have more information in this sense to share with us for sure.
Yeah, I've been looking at this issue rather extensively, but we're a little bit short on time, and I want to capture some of the other questions here. There's one here by Nicholas de la Rota, who asked Dr. Williams, and he says, Dr. Williams, you spoke about the paternalistic nature of organized crime and how these organizations are leveraging it in the short term to build social credibility during the pandemic. He asked then, how have national governments viewed these actions as threats to their own legitimacy or as opportunities to cooperate and work with these organized crimes to maybe help societies? Dr. Williams?
Yes. This is not new. We have seen organized crime engage in social paternalism a lot. We saw it in Colombia with Pablo Escobar, who had a program in Medellin without slums. We saw it in Mexico with the Sinaloa Federation and El Chapo, who was also paternalistic in some ways in his region. And even the Zetas in Mexico at one point provided flood relief after a flood, not least because they were the only ones who had jet skis and they were able to use their jet skis. But I think it is common. We've seen it in the current crisis. We've seen organizations use it to help their brands. So Sinaloa people have been passing out food packages with Chapo Guzman's face on it. Not entirely different from the president's signature on some check relief in the United States. But they've been doing the same thing. They've been engaging in that PR. They do it all the time. I think governments have been more willing to see it at the moment, but long term, I think it is a threat to governments. And here's the kind of issue we see. We focus on the criminal activities, and sometimes we take down a particular organization. One of my favorite examples is the Lorenzano family in the family was taken down. They were involved in drug trafficking, but they'd actually provided flood relief, medical clinics, jobs, gifts at Christmas for children. They did a lot of positive things. So this was a law enforcement success when they were taken down, but the government did not step in and provide government governance as opposed to this alternative or criminal governance. So I think that's the problem, that in some ways it's the vacuum already left by states that organized crime can exploit. It exploits weak states because of the room for maneuver, but it also provides some state-like functions, albeit at the local level, which are organic, in some ways bottom up, and are sometimes, in many parts of Latin America, the only governance there is in certain regions.
Thank you so much, Dr. Williams. I'm going to move on to a question by by Mr. Rafael Crespo. I'll read it as is in Spanish. Cuando se descubra la vacuna, lo más seguro es que su producción no alcanza para muchas personas. ¿Cómo deberían distribuirse esta vacuna? And so basically he's saying if a vaccine is not just discovered, but he means approved and ready for production, he thinks that there won't be enough for everyone. What is the right way to distribute it? And I'll combine that question to you with the other question someone asked about herd immunity and what your thoughts are on that as a mechanism of trying to control the pandemic.
Well, this week is the World Health Assembly in Geneva, with all the 196 member states and 92 member states are meeting. And there is one resolution and discussions to make sure the vaccine, whoever produced the vaccine, it becomes a global public good, or that will facilitate the accessibility to the vaccine by everyone, because the pressure is so much, and some of you have seen the news this week about one pharma company saying that one country will get the vaccine first because he has put more money, and then another country in Europe says no, that will not be the case, because this is not about money. Honestly, this is about saving people. So I'm sure when the vaccine is available, the technology will be transferred immediately, and making sure places like the Serum Institute in India, which massively manufacture vaccines, becomes one of the manufacturers, and others across there are countries in the South that also have the capability to manufacture those. So I doubt this is going to become a monopoly. It's not going to be easy, because when people get confused, when the Oxford scientists are saying that they might have some good news by September and October on the vaccine that they are testing, that doesn't mean the vaccine will be ready. After that, it needs to be manufactured. It needs to be logistically make sure it's introduced into our immunization programs. We need to ensure, any cold chain, any distribution to remote places. This is a major logistic issue. It's not a one day, and that is why there is so confusion, and we need to be cautious by when people say vaccine will be available in 2 months or 3 months. I'll be cautious with that, and at least a year in order for the vaccine to be massively available, because it takes time. Not all the vaccines will go and be successful. Let's see. Let us not forget the experience of dengue, and one company with the vaccine of dengue that was approved and then has to be reassessed and is now very limited. So hang on with the non-pharmaceutical measures for the time being. Ensure that we keep doing those. And when the medicines and the clinical trials come, the proper scientific evidence is there, then we take it from there. Thank you.
Thank you very much. And I think there's some very interesting ways in which there might be vaccine distribution if one of these messenger RNA products proves to be safe and effective, because in that way it would be more of a copyright issue, and it could be manufactured in multiple places. There is a question here that I don't know who to ask it of, and it's about using these to distribute the vaccines using organized crime networks, if that becomes a need. And I don't know if one of you wants to take that up, either Dr. Williams or Dr. Carolina.
Dr. Sampo might have something more to say, but one interesting thing is with dengue and with prisons, right? In both cases, you need, if you're going into the favelas or if you're going into prisons as an outside authority, you need to get the permission of the gangs in the favelas or the gangs in prison. And I think that's important, these areas of alternative governance. I think the one thing that goes for it, and we've seen this, there is this paternalistic element in organized crime even if it's based on self-interest, not altruism. So I think governments can persuade organized crime to help in this case, and it's good for their image, and they would recognize that, and I think that might be overall a plus.
Dr. Williams, and now I would like, we're getting towards the end of our time, and I would like to give each of you an opportunity to give a few minutes of closing statements and thoughts. We'll start with you, just like we did before, Dr. Marcos Espinal.
Well, first of all, thank you very much. I think it's a very excellent conduction from you, Dr. Marty. So my hats to you. I think the message is we're still not done yet. We haven't completed the work, and more difficult times are still coming. I mean, Latin America is becoming the epicenter of the pandemic now, and we need to keep working hard and keep advising governments, advising NGOs to work not only as a government side, because to me, this is an all society approach. It's academia, it's civil society, it's government, it's lay people. So everyone has to do its part. If we don't do our part, we are not contributing. Well, let's not think it's only government responsibility. Everyone has something to do, has something to say, and to contribute. Science in academia, the backbone, like you doing in several outbreaks and other infectious diseases. Government from their part of policy, ensuring they provide for the population, the poorest, and making sure health services can cope with this. But civil society contributing also in community leaders. One of the messages always is engage community leaders, because in the favelas and in the barrios, the public listen to their community leaders. And that's critical in our view. So thank you so much for your time. I enjoyed this very much. And thank you again to Brian and to Florida International University. Over.
Thank you, Dr. Espinal. Dr. Carlos Espinal, do you have some thoughts for us?
Yes, I would say that we should insist in an urgent call to the Latin American and the Caribbean countries to keep preparing and updating all the disease surveillance strategies and capacities, and improving laboratory capacities, and testing, and in addition to really prepare the most undeserved population to be able to respond in the best way to COVID-19. We have seen now very sad situations in Guayaquil, in Colombia, in the Amazon base, in Cartagena as well, in the poor areas of Cartagena, believe it or not, in places like Manaus and in the Amazon base in Peru. So those are the people that are really affected by the COVID-19 epidemics or outbreak, and we really need to support them and to strengthen their capacity to respond.
Thank you very much. I agree, those are very critical situations. Dr. Williams, can you give us any further insights? You've already given so many.
Thank you, Dr. Marty, and thank you for such a great job in the chair. And it's been a pleasure being on this panel with the other members. Let me say, I think in some ways, COVID-19 and organized crime have some of the same characteristics. They are both global distributed problems. They require global collective action in response. I think COVID-19 underlines that more emphatically than anything previously has done. The danger is that we're going to get fragmented national responses. We're already seeing this in the blame game. We're already seeing this in the attacks on the WHO. And I think we need to really think about the need for serious global governance efforts, where we actually start recognizing that the only way to solve these kinds of problems is through collective global action. And I know that won't appeal to many people, particularly in countries where they become nationalistic. But I think that's the one point I say. The other one is, I think we now need to start thinking about lessons learned. And what are the things that we can learn from Germany, from Taiwan, from New Zealand? Recognizing that different countries face different degrees of problems. Some countries have greater capacity. But I think one very important message at the end of this is to say, okay, what are the lessons learned so far? And then we do that again when the problem is further under control. Thank you for having me on the panel. Thank you, Brian, again for the invitation.
Thank you. That is phenomenal, like all of you. And last but absolutely not least, I've been very much looking forward to hearing some more from you, Dr. Sampo. And also, I want to say I noticed some out-of-the-box thinking in some of the things that you presented. So I'd like to hear some more of your out-of-the-box thinking.
Thank you, Dr. Marty. Thanks. First of all, I want to say that I agree strongly with Dr. Williams, with Dr. Phil, I would say. Actually, these global issues requires a global action in order to be defeated. Otherwise, it's impossible. It doesn't matter if we are speaking about COVID or organized crime, it's the same. So it is important for states not to stay inside as they have done from the beginning of this outbreak. But going back to nations, going back to the community level, for me it's very important to highlight that states in Latin America are weak. They don't have so much opportunities to give economic aid, to have presence in all their territory, because some of the territory is very difficult to achieve, as Dr. Espinal was talking about the Amazonian places like Manaus or in Peru or also in Colombia. So it is important to understand that we have a scarcity of resources, and we need to pay attention to all the topics, to all the issues we need to attend. And right now, states in Latin America are focused on the pandemic. But we need to bear in mind that after the pandemic, we will have an economic crisis that will last long. We don't know how much, but that will last long. And we also will have problems with organized crime, since they will be recruiting new members and they will be adapting and being more flexible than state structures. So now it's also the time to try to combat them, even though we know we don't have all the resources we need in order to defeat them. But we can at least make them weak, or at least weaker.
Thank you so much, Dr. Sampo. Thank you so much, Dr. Espinal and Dr. Williams. It has been such an honor and a privilege to be together with you. You're phenomenal leaders in your fields. And thank you so much, Brian, for organizing this panel. And I think that concludes our session.
Thank you, Dr. Marty. Really appreciate your thoughts and insight. You certainly serve on the front lines, and we're grateful for all that you do. Thank the panelists again. It's clear that global pandemics exacerbate underlying social, political, economic, and security issues, and certainly challenge very specific security landscapes, notably transnational crime, organized crime, as our speakers pointed out. COVID-19 is not the first pandemic or epidemic to impact Latin America, and it's certainly not going to be the last. So as our speakers concluded, it's vital that we continue to recognize the impact and invest in the social, public health, and security infrastructure to help our countries move through these terrible incidences. Tomorrow we have another exceptional lineup. Former Presidents Luis Guillermo Solis of Costa Rica And Michelle Bachelet of Chile will kick us off at 9 a.m. In Spanish with a discussion on human rights. And then I'll moderate a panel with Cindy Arnson from the Wilson Center, Harold Trinkunas from Stanford, Laura Gamboa from Utah State University, and the famed Anatoly Kurmanov from the New York Times as we discuss the humanitarian crisis and the prospects of restoring democracy in Venezuela. So also check out impactocovid.fiu.edu. It's a space at FIU that Dr. Marty and Dr. Espinal and others are contributing to with knowledge to help the hemisphere, as our president said, when he kicked this session off, or when he kicked the conference off, South Florida cannot move to day 2 until the rest of the hemisphere moves out of day 1. In other words, we are so interconnected that as long as COVID-19 is impacting the region, it's going to be difficult for us in South Florida and Miami to move beyond the crisis. So check that out. Also keep the conversation going on social media. I know we keep plugging this, and that's because we want to continue to expand the network. So a shameless plug for our Twitter and social media, at Gordon Institute and at FIU LAC. Feel free to tag us, and we'll continue to drive the conversation forward. So with that, again, Dr. Marty, thank you. Panelists, thank you. Bid everyone a safe and good evening or good afternoon, and we'll be back here tomorrow morning at 9 a.m. sharp.